Thank you very much. Good morning, everyone. Hopefully you're not disappointed that this is not about supplements this morning, but I think this is a fun topic, incorporating age management medicine into what you might be doing right now. I talk to physicians and their support staff all the time, and this is something there's a lot of interest in. First of all, there's a huge demand clinically for what we do in age management medicine, and the demand is increasing by the second. The population is getting older, they're getting unhealthier, and people are living longer. Unfortunately, the last few years of their life is not really too good the way we're doing it this day and age. So saw something the other day on the news about that, once again, about how much longer people are living, but the quality of life in the last few years has actually gone down over the last 10, 15, 20 years, not gone up. Plus, I also saw something interesting recently that says this new generation coming along is the first generation in history that we're going backwards in lifespan. First time ever. Ever since they've been tracking this, since the Stone Age, we've been increasing lifespan. We're about to do something we've never done as a civilization, go backwards in the average lifespan. So there's certainly a big need for this. By the way, I know they want me to stand up here on the podium, but I don't stand too well. Probably the only thing I do worse than standing is sitting, so fortunately they don't make me sit. But anyway, I'll try not to drop my mic and throw things and knock things over. But anyway, we'll see how that goes. It's the first morning of this, so I want to make sure everybody's awake here. Just a little bit about me. I do represent different clients over the years, including in the field of age management medicine. Certainly one of the leaders in age management medicine, Cenegenics. I get the privilege of training and consulting and working with new physicians. All the new physicians coming through their program, I do all their training, but I've worked with many other groups, organizations, not only just medical, but also non-medical. Way back in a previous lifetime, I don't like to talk about this openly. I guess I can talk about it to this cozy group here, but I used to be an RN. I prided myself on giving great clinical care, whether it was in a hospital setting, home health setting. And of course, I also had a good business mind, so I ended up going down the administrator route and did that for a while, learned the art of documenting to get paid and good things like that for my physicians, the hospital, things like that. And of course, eventually it led me to sales. I actually wanted to make some real money, so I kind of got out of that and wanted to get into sales. But anyway, I've had the privilege of working with a lot of physician groups in a variety of fields, from plastic surgeons, med spas, HRT places, anything that was typically cash and high-end. As far as looking at the opportunity of opening up an age management practice or maybe incorporating that into your current practices, a few things that we'll discuss here briefly. One is you do need a professional space. Now, by the way, I'm not here to promote any one entity, or I'm not representing an organization today in age management medicine. Just want to give you a broad overview of how you would go about, what to look for, what to do as far as growing a practice like that. But I think the only slight bias I would have in this presentation would be toward cash. I always have kind of a bias toward cash for some reason. Anybody else have that bias? I love to make it and I love to spend it. So I guess that's a bias toward cash. There are people who go through the insurance model. By the way, I'm going to really do my best not to throw in some ex-wife jokes. My physicians that I train all the time know I'm known for 1 to 2 per hour. So in this hour session, technically I should get 1 or 2 in. But anyway, I'm going to try not to do that here for AMMG. They had me speaking at 2:15 also. I don't want them to kick me off the speech here and put somebody in at 2:15. So I'll try to behave up here, if at all possible. Now, if you meet me at the Chandelier Bar later on tonight, I'm going to make up for not getting to talk about it for this hour. So anyway, I'll be rolling them out there over some drinks. But anyway, so we do need a few things to look at. One is professional space, because if it's a cash practice, more of a concierge type, 5-star type service I'll talk about, you do need to have the right space. You can imagine having a space where I have sniffling Medicaid kids in this chair, and right over here I have somebody I want to charge $1,000, $1,500 a month for an age management practice. May not be conducive to growing a practice that way, so you have to look at that. Certainly some basic diagnostic equipment for age management medicine. I listed a few. Does not have to be each and every one of these, or it could actually be some other ones. But a VO2 max, a DEXA scan, even the CIMT, there's things to look at that a person would not get at a typical physical. Carotid ultrasound. So it's a good, good diagnostic test to have. VO2 max, exercise physiologist talk about that and use that all the time. You'll hear a great speaker later on today, Jennifer, who obviously uses tools like that. DEXA scan to test bone density, but also lean muscle, body fat, things like that, because that's what type of things people pay for in an age management practice. Certainly you'd have to look at educating the staff on the clinical indications and other qualifications. You may have staff. Now, I know I have a mixture here of physicians in the group. How many non-physicians in the group today, by the way? If I could just get a couple of y'all, just tell me what your title or what you do real quick in your respective practices. Executive director, okay. Okay, spot director. Managing partner. Okay, so different variety of non-physicians here. So for non-clinical staff, I'll call it, people with a non-clinical background, if they're part of this practice, they're going to have some basic education and training. They may not certainly have the training to the degree of a physician, or in the lifestyle component, exercise, physiology, nutrition, all that. They may not have all of that depth of education and background, but they do need to have a working knowledge of that if they're going to represent that type of a practice. Kind of need to walk it and talk it, actually, if you're going to charge people many hundreds or even over $1,000 a month to look good and feel good and not go through insurance and go through a copay, then all these things have to be lined up before you do this. Some type of physician certification and training. Again, I work with, of course, a large group that does that, but I'm not here to represent any one training, but there's multiple ones out there. Find the one you're comfortable with, and I recommend you physicians go through a full certification and training. It constantly amazes me when I talk to different physicians that really are looking at doing this, what the lack of knowledge on age management medicine out there in the physician world, much less anybody else's world. In fact, it's downright scary. I think physicians certainly know that in this room. If they've not done HRT or done some kind of a age management type practice, they know that they don't have training in that in medical school. So not only are they not qualified to treat patients in this setting, it's actually dangerous. We have patients coming in all the time that we've had somebody dabbling in age management medicine, obviously didn't quite know what they were doing or didn't have the additional training and certification, and they have problems. Even now, I'm not a physician, but I did briefly play one on a soap opera, so I know what I'm talking about here, everyone. By the way, I've also played an attorney, so if anybody needs legal advice after the break, I'll be outside there. Just don't ask me about divorce cases. Apparently, I'm not very good at that. But anything else, I'm pretty good legal advice. Anyway, you need to go through some kind of certification and training. Learn how to use the diagnostic equipment, things like that. It will be new even to physicians I work with. Sometimes they've never done a CIMT. They don't know how to do the DEXA scan, so it just takes some basic training. So the next thing we'll talk about is look at identifying age management medicine patients. You're looking for a certain type of patient here that will pay that kind of money to get the clinical results that we're looking for. By the way, every time I open my mouth in any environment to talk about age management medicine, I always think of two things that come to mind. Everything that we do, it goes back to just two things: the clinical side and the business side. And both sides have to work. There's a lot of people with great intentions. I've met some great clinicians over the years that had wonderful intentions and wonderful clinical experience and expertise. They could not make the business side work, so guess what? It don't work. It was a nice dream and it failed. Or if they operated it, it went under, basically. The other problem sometimes is we have people who have great business minds. In fact, some of you identified yourself as a title that would be a business-type background, your business element of operating some kind of practice you work with or own. And sometimes the business side don't know the clinical excellence side. And they want to cut corners and all that. It's all about the bottom line, net profit and all that, and that also does not work. It has to be a nice marriage between clinical excellence and making the business side work. That's why you need to go and get training on this, and also hopefully training in the business side of it also, ideally. So the ideal patient. You can certainly look at your current patients. Many of y'all have type of practices. I didn't get a chance to meet everyone here. I don't know what everyone does in a practice. You may have a family practice. You may be an ER doctor. You may have a weight loss clinic. You may be doing HRT. You may be doing all kinds of things out there. But many of you already have current patients who would fit the bill and be excellent candidates, going back to the two things I said. Can I help them clinically, and can we make the business work for that person anyway? Can they afford it? So we look at our current patients. Are they age appropriate? We're typically looking at the signs and symptoms of aging that normally start happening roughly in mid-30s or so. The typical age management patient is probably 40s, 50s, and 60s in that age range. In fact, the group that I work with, we know exactly what, after 15 years, the median age patient is 53. So 40s, 50s, 60s on up is your sweet spot as far as age. I will say that I'm noticing a trend that people are starting to become more proactive earlier on. They're not waiting till their 40s and 50s, till they have their own blood pressure and cholesterol medications and already a type 2 diabetic and with one foot in the nursing home already by the time they're 50, 55 years of age. They're looking at it a little bit sooner, which is good for them, and ultimately it's good for the industry.